Guys, welcome to Health and Wellness Sport, and I am Dr. Lewis. Now, varicose veins. So, what are varicose veins? What are the causes of varicose veins? What are the symptoms? And then management, both interventions that are surgical and dietary modifications that will help you recover from varicose veins. So, by definition, what are varicose veins? Most of you know if you've suffered varicose veins, they appear on your extremities, basically your legs. Okay, so they appear to be swollen veins on your legs, and they have like a blue or purple color because this is veins. So veins carry the oxygenated blood, which is from the body towards the heart and the lungs to be oxidized. So since they carry the oxygenated blood and it has a deep color, and therefore they'll come out or appear as blue or purple in color. Now, varicose veins have several causes. So the first thing, before we even talk about the causes of varicose veins, let's talk about how or what will predispose you to varicose veins. That can also lead us to the cause. So what predisposes you to varicose veins is basically, number one, has to be pregnancy. And how does pregnancy predispose you to varicose veins? Pregnancy, once the uterus starts to grow and bulge, then it exerts pressure to those veins that supply your extremities. And we already said that these varicose veins happen mostly in legs. So if you have this pressure being exerted on veins that supply the legs and extremities, then you will have an increase in venous pressure towards your legs, and this can rupture those valves. Because remember, the cause of these varicose veins is basically weakened or destroyed valves. So they are valves that block blood backflow in veins so that it can head in one direction. And once you weaken those valves and you weaken the walls of the blood vessel, specifically the veins, then you make it hard for blood to come off from the veins towards the heart. So you make blood flow back and cause venous pooling. So there's a lot of blood that is pooling in your extremities. That's exactly what happens for them to start bulging and causing that pain. Again, we have a hormone in pregnancy that is called progesterone, basically the hormone that helps you maintain that pregnancy. So this hormone is the one that also can cause a relaxation, either relaxation or toughening of blood vessel walls. And this makes it hard for these blood vessels to stretch and contract, and therefore it will start destroying the cartilage, the blood vessel, and also those valves. So it causes blood pooling. Then you have genetics. There are people who are just basically born with weak valves and issues with veins. So that can be a predisposing factor. Again, as you age, then your life becomes sedentary, because this condition happens mostly in women than men. But as people age, women get higher contents of estrogen, which is basically estrogen dominance. So once you get estrogen dominance, you start growing fat and obese, and you start having all these hormonal issues. And again, that will bring you to blood pressure, and also obesity is another factor here. Okay, so towards the end, we'll talk about obesity. And you see, obesity is prone in women who are growing older because of estrogen dominance. And also men, when you start limiting your activities, you start limiting exercise in the gym, then definitely you will get to obesity. So age predisposes you through that channel. Then again, obesity and hypertension. Obesity basically again increases blood pressure, because when you're fat, there's an increase in blood pressure, and also diabetes. Those two predispose you to varicose veins. So if you are overweight, that has to be number one reason why you are experiencing those varicose veins. So you can imagine if you're obese and then you're old as a woman. So you have this estrogen dominance as a result of menopause, and then you have a sedentary lifestyle. So you'll get into obesity, diabetes, and hypertension. So that is like triple tragedy, because that will totally get you into varicose veins. So if you need to recover from them and you are beyond menopause and you're obese, then the first thing you have to do is start editing your diet so that you start losing that weight. And once you lose that weight, then you start recovery process. And you also you need to treat, apart from just treating diabetes and hypertension, you'll also need to treat the infection. If at all those veins are causing infections and inflammation, you'll have to treat that through means that we will talk about. So women are highly predisposed to varicose veins because of estrogen and obesity. So most women are obese as compared to men, and women don't like being involved in physical activity that can help you improve blood flow. Also, reluctance in dietary modifications, because women enjoy a sedentary life by eating in restaurants. So this is a problem. Then injury and trauma, basically again, if you get an accident, you've been involved in any physical trauma, maybe you're playing a soccer or rugby and you get this trauma, those injuries can lead you to a venous pooling and destruction of blood vessels, and also the blood vessel valves. Above all, smoking. Now I told you, smoking is one factor that is involved in basically all medical conditions. Why? Because smoking causes inflammation, and inflammation is one thing you need to avoid when you're going through varicose veins. And inflammation is also as a result of obesity. So how do we treat this? Now, there are several ways that you can treat varicose veins, and number one has to be sclerotherapy. I want you to know there are two methods that are like related: sclerotherapy and endovenous laser treatment. So sclerotherapy, what it does is we are just trying to inject a fluid or a chemical in your vein, in that vein that is affected. When we inject this chemical in that vein, this chemical goes and blocks that vein totally. So that vein stops carrying blood. So you block it totally. Once you block it, you redirect the blood flow in another vein, and then change your lifestyle. So those are just the three management forms that involve a laser, that involve chemical injection, and they involve surgery. So the best way to do this thing is one, even if you go through these surgical procedures and these processes, then you have to edit your lifestyle. And that's why we go to lifestyle modification and changes. So what do you do to enhance your diet, to enhance this management, and maybe improve from symptoms, and also prevent the formation of new varicose veins? Because remember, those varicose veins can be a problem. They can get you into getting infections and inflammation, and therefore you end up in serious trouble. So in this channel, what we do normally as a result or as a solution is focus. So once we focus, what are we focusing on? Number one has to be high fiber diet. When you talk about high fiber, fermented cabbage is high fiber. Both probiotics and prebiotics, high fiber content. So it is a superfood for this one. And remember, high fiber diet like cruciferous vegetables, the spinach, the broccoli, the kales, the cabbage, all these, what they do is they contain compounds called flavonoids. And these flavonoids are anti-inflammatory compounds in your system. So once you eat these foods, this high fiber content, even beans, those flavonoids will help you recover from inflammation that has been caused by those varicose veins. And therefore, you start recovering slow by slow. However, also know that this process took a lot of time, so it has to take some time before it disappears and before you start recovering from it. So a high fiber diet is very important for you. Consume those vegetables in plenty. And also remember, vegetables have high content of enzymes that break down estrogen. Okay, so that will mean they will start helping you recovering from obesity and hormonal imbalances and estrogen dominance. So that is a very important factor on vegetables. However, the issue with vegetables is you might end up getting constipation with over consumption of vegetables. And if you're going through constipation, please take note of this vegetable point. You can reduce your vegetable intake to like twice or thrice a week. You don't need to eat vegetables every other day, because vegetables can cause constipation. And how? When you eat vegetables, remember they have high content of fiber, and this fiber is intended to feed the bacteria in your stomach or your gut, the normal flora. So if you eat high content of vegetables, you overfeed this bacteria. Remember, these bacteria feed on this fiber, and then they help you get vitamins, amino acids, help you in absorption, help you to prevent development of bad bacteria in the gut, and also help you heal from leaky gut. So these bacteria are very important. So if you feed them too much, they become very reluctant. Okay, so what they'll cause you is basically bloating, indigestion, because you will not digest the protein because this bacteria are just relaxed now. So it causes you indigestion, bloating, and constipation, because you cannot now break down food that is rich in fiber through the help of this bacteria. They are overwhelmed. Okay, so you'll get into constipation, and somebody will tell you to take a lot of water, which is again is a lie, because we already say that the gut is not a hollow tube that will just dilute stool and to give you that soft stool. So you'll now have to reduce your vegetable content and help these bacteria recover. Once they recover, they start helping you break down food and those food substances that are in the rectum, so that you get you clear the constipation. Okay, so that is to note about fiber. Number two is antioxidants. Antioxidants are basically foods that are rich in vitamin E. Okay, and these foods that are rich in vitamin E, the first thing has to be cabbage juice. Okay, so there we go again with the cabbage. Apart from it being used as a fiber, it also has glutathione, which is basically an anti-inflammatory agent and an anti-detox. It helps you detoxify the system. Also, it is an antioxidant. Okay, so vitamin E rich foods are antioxidants. And if you consume high content of vitamin E, that will mean you will clear this condition. Also, vitamin E prevents blood clots. So if you prevent blood clots, then you'll have an easy time pumping off this blood from the veins Again, on this point, remember, there's something called sugar. So we will talk about it down here as we talk about the zeros. But here we have sugar, and sugar will attach to red blood cells and cause stickiness. So they will stick on those blood vessels and then start causing that occlusion of blood vessels. So you can imagine you're already having varicose veins. So your valves are failing, and then you have this occlusion of these blood vessels. So what you'll end up in is just a worse condition, okay? And you might end up getting that foot amputated for no good reason because of ignorance. So that is vitamin E. And what are the foods that are very rich in vitamin E? So these are basically avocados, these are basically nuts, okay? And those types of foods. Again, remember, vitamins, all vitamins are blocked. The absorption is blocked by sugar. So for instance, vitamin C, which is another factor here, and vitamin E, the two, you cannot absorb them if you're eating them with sugar, because sugar will block their absorption. Also seed oils. So inflammation will cause you problems. So what we are doing is we want to lower inflammation and increase the anti-inflammatory effect. So what are we doing? We want to lower omega-6 and increase omega-3. And what are the substances that bring you omega-6? Sugar, wheat products, seed oils. Those are the foods that will bring you a high content of omega-6, which is highly inflammatory. So if you want to balance that ratio or exceed omega-6 with omega-3, what we do is you consume a high content of liver, avocados, fatty meat, those eggs, eat them in plenty. So those are just and seafoods. So those will help you recover from these conditions. And then vitamin C. Vitamin C is high in also the number one thing that we mentioned in fiber, the sauerkraut, fermented cabbage. High content of vitamin C. Vitamin C also is an anti-inflammatory and is an immune booster. So you'll get it in fermented cabbage. You'll also get it in all forms of pepper. And again, you'll get it in lemon peel. So the peel of the lemon has high content of vitamin C. However, do not boil that peel because you'll destroy vitamin C. Now, on this note, those tablets that you buy in the pharmacy that you think contain vitamin C, the ascorbic acids, they are not vitamin C. Ascorbic acid is just a portion of vitamin C, and we have a video that explains how vitamin C, the structure. So ascorbic acid is basically synthetic vitamin C and is not vitamin C. So it will not help you in this condition. You need natural vitamin C, and it's in the foods that I just mentioned. So avoid those tablets. Then hydration. Hydration, most of you think drinking a lot of water will lead you into hydration. That's a lie. If you drink a lot of water, you will get into dehydration because this water will start flushing off electrolytes like sodium. And once it flushes off electrolytes, then you'll end up excreting more water than you thought. So drinking a lot of water can get you into dehydration. So what you do is you add a pinch of salt in that water to help you absorb the maximum amount of that water and also help you hydrate adequately. So not that. So add a pinch of salt in your drinking water all the time, because that will help you absorb optimal amount or maximum amount of the water that you're drinking. Again, I know some of the articles that have been published tell you that you should avoid a high amount of salt when you have varicose veins. I want to tell you for free that salt is very important in this recovery process. Why? Because salt causes softening of blood vessel walls. So once it causes softening of that blood vessel walls, it helps them in flexibility. So they can accommodate a high amount of blood and also a recovery from that atherosclerosis and that hardening of blood vessels that inhibit your blood flow, which increases your blood pressure. So salt is very important in recovery from this. And do not be carried away by the Himalayan salt, the sea salt, and the normal salt. Don't be carried away by that narrative. Understand that salt is salt and salt is sodium chloride, and therefore you need that sodium chloride more than you need Himalayan or sea salt. So concentrate on sodium chloride rather than the source. Then weight loss. This has to be number one actually on this list before you even start eating. You have to lose weight. There's a video that talks about diets and healthy eating. So these foods are supposed to help you lose weight. Once you lose weight, you control your estrogen levels as a woman. Once you also lose weight, you reduce blood pressure that causes that causes venous pooling. You'll also start recovering from insulin resistance and diabetes. Therefore, this condition, because all those that I'm mentioning are predisposing factors to varicose veins. So once you recover from that, then you start recovering from varicose veins. Okay, so take note of that. About weight loss, you have no option. You have to lose weight to an optimal or adequate weight. Then the last one has to be zero. What are the zeros? Zero sugar, zero seed oils, zero wheat products, and reduce your omega 6 and start increasing omega-3. So basically, again, zero processed food. So do not eat restaurant foods. Try as much as possible to eat whole foods. Try as much as possible to consume complex carbohydrates. Combine them with fatty meat, fatty fish, all this protein, chicken, combine it with liver, organ meats, and eggs. These are foods that will raise your omega-3. And then avocado is very important in this process. So these are basically dietary modifications that you can use to help you recover from varicose veins.